So in the next half an hour, I'll be giving a discourse on professional ethics, and I'll be giving you some guiding principles. And believe me, when you apply these principles in your day-to-day practice, you will certainly better at your soft skill of professional ethics. And not only so, as you negotiate your journey of training alongside your supervisors, they'll also be very instrumental in imbibing the skill of professional ethics in you. So let me begin off with a statement one of my friends who was visiting abroad, and unfortunately he met with a road traffic accident, and he was taken to a hospital and not aware as to who is going to see him or how he's going to be treated. And the only thing that he wished for, and that's what he mentioned to me, was I really wish that my doctor embodies professionalism and ethics. And this is how important these traits are. And I'll just take you through these different principles in the next half an hour. So when we talk about professional ethics, a lot of you might think that it is something, and a lot of seniors also think that it's something which is caught in your day-to-day practice and something which cannot be taught. Because as your teachers, and we have always been teaching you the right treatment for the patient, which may or may not be the good treatment. So what's the difference between right and good? Is it just a difference of word? Are they synonyms? And there is a subtle difference. And the subtlety of difference is basically when we add patients' values and preferences into action while taking a decision for a patient, your right treatment gets converted into a good treatment. So remember this for your entire practice. Whenever you are taking a decision for a patient, always take into account their values as well. When we talk about professionalism and ethics in the past, it was diffused very passively through a hidden curriculum. And this hidden curriculum was basically when the students would watch their seniors uh, as to how they are dealing with their patients in their day-to-day practice or situations. But the problem with this kind of hidden curriculum is that a lot of it is left to chance. And that's why the need. And what was also understood from over a decade that the hidden curriculum, because of the daily happenings that you see, has failed to impart these virtues of professional ethics into our medical graduates. It's not that I'm trying to blame medical graduates, it's because, as you and I would understand, there is a phenomenon of universal mutation in human values that has occurred. So we thought as a team of professionals over here at this institute, it is very important for us to explicitly put forward the core principles and also expand on the attributes which are expected out of a professional. And by putting this class or by enlisting this attributes which are expected out of you, it is not to undermine the value of hidden curriculum, which you will learn from your day-to-day practice, but it is just to empower it. So I'm sorry, I mean, I won't be able to take this slide. There are a lot of people who would still think that it cannot be taught. There are people who would just sense what is right and what is wrong, and they are motivated to act. While we as a group feel that people differ in their abilities, and most of the people can improvise on their ethical decision making through education and practice. And that's the reason this lecture has been organized. So, I mean, this is something I asked to myself, and I think you might also be facing this question. Do we think differently when we are talking about science and we are talking about ethics? And what is very important in medicine is science and ethics, they have to go hand in hand, you know. There cannot be a disparity between when you start thinking scientifically versus when you think ethically. And that will help you find out the answer for your particular patient as to what is reasonable or what is fair. It might not necessarily be the best, but in that particular situation, when you're dealing with a patient or a patient attendant, what is reasonable, what is fair? And that is why medicine is an art, and this is the part of the art. So again, briefly taking you through different aspects of professional ethics. So I'll basically debrief about what is profession, what is ethics, what is professional ethics all about, and what are the ethical theories which provide us the framework to work on professional ethics. So what's a profession? And this is a textbook definition of profession. A profession, basically, it's a person who has a job that needs skill, education, or training. And you know what is the difference between profession and occupation? All professions are occupations, but all occupations are not necessarily professions. You are a professional because you have been skilled, you have been educated, or you have undergone a specific form of training. That's why you have a profession, which is called as medicine. And profession, generally, it has a group identity. There is some form of shared training, shared education. There are requirements for admission. All of you must have gone through your exams, some NEET entrance, etc. And what is also very important to know is that a profession has some special knowledge which is uncommon and which is not available in the public domain. For example, I mean, now Google offers everything, but Google cannot, teach you to perform a surgery. So it is some form of uncommon knowledge which you learn via training. And this knowledge that you are imparted when you're training, it is used in the service of others. So there is a positive social need. A very important thing about profession is that there is some degree of autonomy, which is given to an individual. It allows for some degree of individual judgment, so which gives some degree of autonomy to you when you're dealing with one case vis-a-vis other. And there is adherence, you have to adhere to certain values. And the most important is there are penalties for substandard performance. So if you err in some way or the other, there are some rules and regulations which would impose penalties on that profession. So what is professionalism? So that's all about profession. Professionalism is basically the skill or the competency at work. And there is an element of relationship that it is going to be beneficial to others. So your competence is important, but besides that competence, it's important when you apply that work that has to be beneficial to the person on whom you're applying. What's also important to note is work, when you think about work, it itself does not has a moral status. It's only that the execution, the way you execute work, it has a moral status. So basically, professionalism is it constitutes of the attributes, the behavior, the commitment, the values. All these ideas or goals that characterize a profession constitute professionalism. And in medicine, there is a very strong societal role and emotional component that is also involved. So the attribute and the behavior that is expected out of a medical professional to exhibit professionalism is also influenced by the expectations of the society. And remember, at least for medicine, there is some contract, there is a contract between medicine and society. And I mean, all this philosophy, it remains vague for many of us because it bridges two very seemingly unconnected quantities. And most of you must have heard about evidence-based medicine, but a lot of you must have not gone through professionalism. But basically, professionalism is actually a bridge between this evidence-based science and the emotional, psychological beings that we touch. So I spoke about values and attributes. So what are the attributes of professionalism? There is a degree of responsibility. So that's very important. You have to be competent and self-improvement. And this competence and self-improvement is, going to go, you have to be a lifelong learner. Even for me, at this position, I have to undergo lifelong learning in order to be competent at my work. You have to have respect for others. And not only for others, when I'm talking others, it's not only patients, attendants. It's different people that you come across, your fellow colleagues. There is a degree of social responsibility, honesty. You have to take care of your health as well. That is also an attribute of professionalism. And you have to function under stress, and you need to understand how do you function under stress. You cannot, lose control when there is a situation of stress around. You have to take care of your appearance. So be dressed properly. There has to be a degree of tolerance. You just can't, reply back even if you do not like many things. So there has to be an element of tolerance, and the way you have to conduct yourself in such a way that people depend upon you. And the last, most important, is also research ethics, which I'm not going to cover. The next lecture is going to be covering upon professional research ethics. And all these points that I've mentioned, it's basically, the bottom line is how to understand and understanding and knowing how to relate with people. So can I teach you professionalism? And that's what I mean. I'm taking you through different vague concepts. And I think the best way that people would learn professionalism would be from role models. Bedside teaching was a very, very important way wherein the old timers would impart professional skills, professional ethics to their students. I don't know whether you have heard about simulated patients. I had an opportunity to go abroad wherein they would simulate situations. So you would have patient actors and they would simulate a situation and ask you to react to that situation. And then they would, tell you as to whether or not you reacted or conducted that situation in a proper way. That is how they do it, at least in some of the institutes abroad. Group discussions. They also help you improvise on your professional skills. What is very important, all these lectures, we always teach from the ideal, but the best you're going to learn is from your day-to-day practice. That is from the real. And to a certain degree, assessment, a peer feedback, patient feedback, evaluation, a 360-degree evaluation also helps you improvise on your professional skills. Now, that is all about profession and professionalism. What is ethics? Watch the language. The right or wrong are considered as actions, and good and bad are basically motives. So actions are labeled as whether they're right or wrong, but your motives, your goals are labeled as good and bad. So ethics basically can be defined broadly as a set of moral principles or values. Each of us has such set of values. Ethics comes from the word ethos. Ethos means a place of internal dwelling. So you refer to these internal values when you are faced with a situation. And each one of us might have a different value system. And this value system that each one of us might have will depend upon the environment we are brought in, our education, religion, family, so many things. And we may or may not have considered them explicitly. I mean, now that I'm mentioning it to you, you might think over it. But this is what ethics is all about, relating to your value systems. So, what's the need for ethics? And ethical behavior, it's very important for society. This behavior is very important for society to function in an orderly manner. And the need for ethics is sufficiently important. It's so important that some of these ethical, values, they are incorporated as laws. So that's what the need of ethics is. And what is professional ethics? Professional ethics basically helps us to decide when we are faced with a problem that raises a moral issue. It can be complex, many people can be involved. There can be many issues there when you're in a situation, and who decides that whether it is an issue at all or not? So it's complex. And what's also important is this professional ethics, they are implied in practice. They are not visible. They are subtle skills and they are mostly unspoken. You don't go on speaking about professional ethics to people. And the other very important thing is that you might be very knowledgeable or competent, but this component of professional ethics does not build on only knowledge, but also your personal beliefs and feelings or your value systems. So, this is what professional ethics is about. Now, talking about ethics and morality, morality is basically making choice with certain reasons. And ethics is basically studying as to how the choices are made. So basically, ethics is the study of morality. And often we use ethics and morality interchangeably. What about ethics and law? Law, the authority is external. Ethics, I told you, it comes from the word ethos, your internal dwelling. The authority is internal. That will depend upon your value systems. And basically, it is based in morality. Uh, all of ethical issues might not necessarily be addressed by law. So, coming to professional ethics and law, there is a moral duty to obey the law. And professional ethics, when we talk about professional ethics, it covers more issues than law itself. Uh, so that's why one can be unethical, but because it's not covered by a particular law, it might not be illegal. And rarely you should come across a occasion where you should resist the law. So, piece of advice to you, if there is a law which is existent, never embark into an exercise for ethical analysis when there is a clear legal rule in that situation. And do not assume that there is a legal rule for every situation. Often there are gaps between legal rules which require one to switch over to an ethical analysis. So what is this ethical analysis? And there are some foundational theories for ethics. And philosophy, interestingly, has played a very vital role in the development of this ethical discourse. These foundational theories, they continue to provide a framework upon which these concepts are formulated and discussed. There are two valid moral theories. One of them is the non-consequential, and here you classify an action to be right or wrong. You faced with a situation, you classify your action that it is right or wrong, regardless of what are the consequences of your action. And this is in accordance with a moral rule. The right and your classification of the action as right or wrong is in accordance with the rule. And who lays these rules? These rules are laid by God, or for example, religion, by reasoning, or by rational beings. And this is one of the theories. And the second theory is basically utilitarian. So basically, the moral this thing is that you classify action to be right or wrong depending on the consequences. And it believes that human beings ought to behave in ways that results in the greatest good. So basically, it's the consequential theory. So depending upon the consequences, you classify it as right or wrong. But the above theory is more of duty bound. So and it is basically based on some reasoning or rationalization. And you will be, flipping between these two theories. The third theory, which is virtue ethics, it considers action to be right if that action would have been taken by a virtuous agent. And virtuous agent can be different depending upon the cultures that you are in. And there are different virtues which are considered, which help us define a good physician. And these are the different virtues: benevolence, that is providing benefit to all; justice, loyalty, friendliness, courage. So a person who carries all these attributes you would consider that to be a virtuous agent. And when you are faced with a situation, you would look up to the how that virtuous agent would act in that situation, and you would also follow him or her. So that is what is virtue ethics is all about. So basically, a moral theory is a broad perspective which helps us decide as to which element, the right or wrongness, the virtues, or the consequences, which of them is important to you, you know. And this, using this theory, you help resolve the conflict. And how we come across these theories, it might be family, religion, culture, experience, and education. So what is important in using this moral theories is not what is decided, but how it was decided. And theories, they help in identifying values which are important to an individual. And these moral theories, they help us explain why they hold the values that they do. So some of the moral framework in the past was also provided by something called as an oath. And everyone of us is aware of a Hippocratic oath. What is also important to understand is oaths do not necessarily compel ethical behavior, but they are human instruments that are crafted to sensitize the reader to moral moments and choices. Coming back again to professional values and virtues, there are two qualities which are very central to the notion of good doctor or professionalism. And if you apply this in your day-to-day practice, I think it would solve many of your problems. One of them is altruism, and the second one is obligation. So what's altruism? Altruism is the idea of the physician working primarily in the best of others. That's what altruism is. It's a behavior. It connotes an attitude or disposition of the physician to act for the benefit of the others. And it, as a principle, it becomes morally compulsory also. And what is an obligation? When a patient entrusts his or her care, certain obligations are very, immediately implied. And one of the most important moral responsibilities is fiduciary duty. Fiduciary comes from the Greek word fida. Fida means faith. So it's basically the relationship of confidence or trust that develops between the patient and the doctor. So the patient entrusts his faith on the doctor to basically proceed with the decisions that he's taking for him or her. And this duties, they require the highest standard of care and maintenance as well as extreme loyalty. These obligations, the moral obligations and fiduciary duty, they really require extreme degree of loyalty. This fiduciary responsibility that accompanies at least us as a profession is one of the principal difference between working in an occupation and practicing a profession. So brief again, summarizing, it is an essential dimension of our work as physicians. We rely often without knowing it on its principles to formulate judgments, make decisions on behalf of our patients. We need a framework, and I gave you some moral theories which you could choose depending upon your value systems. Uh, and Professional ethics, with its philosophical foundations and along with our critical input as a profession, also helps us in improvising these tools in developing the framework. It is important for an institution and for individual professionals. Sometimes solving these ethical dilemmas could be very difficult, but believe me, if you apply this in your day-to-day practice, your experience, your learning from your peers, from your mentors, you're going to get better at it. And ultimately, the reason for this lecture is basically our challenge for our profession remains that all of us should critically explore always and always the age-old good question: what does it really mean to be a good doctor? Thank you very much for your attention, and I would be happy to take any questions.